help spread hope and support in the fight against cancer. Singing River Health System is looking for volunteers with that kind of motivation to donate their time to patients in need. Here to tell us more about their new chemo-sabe volunteer program is Dr. Michael Finan and Chief of Women's Health at Singing River Cancer Center, Melinda Finan. Thanks so much for joining us today.
Thanks for having me.
Yeah, so tell us a little bit about this. It's a new program supporting cancer patients undergoing treatment at all three of the facilities here on the coast, right?
It's in the infusion room where they get chemo and different kinds of infusions. It's all cancer patients. And basically the chemo-sabe will give patients snacks and drinks and kind of, make them feel comfortable, give them a warm blanket or a pillow, and just talk to them and just try to make them feel a little more comfortable where they're going through an uncomfortable situation.
Yeah, and you two are no stranger to cancer. I mean, you work in the cancer center over at Singing River, but your son actually underwent treatment, correct?
Yes, my son had testicular cancer when he was 20, and I saw firsthand how the chemo-sabes worked in Mobile, and I thought, well, this would be a great program for all the hospitals in southern Mississippi.
Right. So how long ago did the program start up?
We're just
starting it now.
Okay.
She's the only volunteer right now.
Oh wow!
That's
yeah.
why
So
we're
you
here
definitely.
today.
Yeah. So we're trying to recruit volunteers
Yeah.
to come in, in 4-hour shifts, a couple of times a week, if we can get them in that much.
Right. So is there kind of training for it, or you need to meet some minimum requirements?
It basically volunteers have to be onboarded like an employee.
Okay.
You go through. It's very easy. I mean, I made it through. So they have to take a little, read some modules and take a test about, safety and
privacy,
patient confidentiality and things like that. And then you have to get blood work done, and then you're pretty much a security check.
Okay. Yeah.
And then
a background check.
Background check. That's what it's called.
But importantly, you don't have to be a cancer survivor to be a volunteer. And you can volunteer for 1 shift a week, 1 shift every other week. There's basically 10 shifts, Monday through Friday, 8 to noon, and then noon to 4 or end of day. And we're just looking to try to fill up all of those shifts across all 3 sites, Gulfport, Ocean Springs, and Pascagoula.
Yeah, how many volunteers are you thinking you may need to fill those positions?
Sky's the limit.
Yeah,
Just
for
as
sure.
many as we can get. Yeah.
How important do you think this is for the patients and volunteers alike?
I found it very rewarding. Like last week I was in Gulfport, and we had some talkative patients, which I really enjoyed getting to know them and spending time with them, and it helps the nurses out as well, because I know, and they spend, like in Pascagoula, they spend an hour of their day doing non-nursing care. So this will take a load off of them and make sure that the patients have a good quality of care while they're
For sure.
They help the nurses. That's a big help to the nurses, because they can answer the phone, they can bring patients back, they can go to clean the chairs, go to the pharmacy,
go pick up the chemo
help
drugs,
patients to
go
the bathroom.
lab.
Yeah, very rewarding. Just real quick, tell us how people can volunteer if they're wanting to take part in this.
Well, Megan Yankee is the director of volunteers, and they can call her or email her, and we will have that on your website as well as our website.
All right. Well,
phone number and an email address.
Great. Well, we thank you guys so much for being here today. This sounds like it's going to be an amazing program and help a lot of people.
Really looking forward to getting it going.